Hello, everyone, and welcome to today's podcast on health literacy and workforce well-being. I'm Seth Serxner, Chief Health Officer at EdLogics, and today I am very pleased to be joined by Alden Pennington, who leads the Talenta HR group and has been an HR executive for many years, especially in the healthcare sector. And so really looking forward to the conversation today, Alden. Thanks for taking the time.
Thanks for having me.
Yeah. So, we've been getting to know each other a little bit, but if you could take a minute and just tell the audience today a little bit about where you landed now, but also where you came from and how you got there, that would be really helpful.
Yeah, sure. Well, I'll try to sum it up as easily as I can. But my short story is that I tripped and I fell and I landed into HR, and I've thus made a career of it. I'm not sure I've met all that many people that get into HR or recruitment for that matter on purpose. It typically is a kind of a side door. But I went through that side door and did it in healthcare space. And that's where I've stuck, community-based systems. I had a short stint in the healthcare tech industry and then into private equity. So I've seen much of anything that you can imagine across the healthcare spectrum, and I've done it as a executive on the HR side of things. Most recently, as you mentioned, I'm the founder of the Talenta HR group. This is something that was a side hustle for a number of years, but has recently become my full-time hustle. About 18 months ago, a little bit over, decided to make this my permanent occupation. And so I'm doing executive search, some consulting, and doing it all in the healthcare space, which is where I feel my best.
So I have so many questions for you, but let's start with kind of the today stuff. So in the executive search space, especially for healthcare executives, what are people looking for? What's kind of the challenge in that space and or kind of the big, opportunities? What's hot? What's happening?
Depends on which level you're looking at. If it's leadership level, you're trying to entice people from other industries, and that's something not everybody's comfortable with, but I think there's more of an appetite for that as we see systems thinking and process orientation being more prominent as a requirement, be more tech savvy with the advent of AI, any number of things there. Healthcare, we can be honest, is not the most innovative in all cases, at least once you get outside of patient care, management practices, the use of new technology, but other industries are further ahead. So there is now a request from a number of my clients to look outside of the healthcare spectrum. When you get lower level, this is the case for all of healthcare, clinical positions are in such high demand and short supply. Schools are not generating enough students and enough graduates. So we have a crunch there that we've seen for many years. It's just exacerbating and getting worse as time goes on. The solutions there are beyond the scope of this conversation, but I'm sure they're legislative and really impact the school systems as well.
All makes sense to me. It's so interesting because on the one hand, you think of all the industries, healthcare seems very much like you would need healthcare background to run a healthcare organization. But on the other hand, just as you said, it's really helpful to apply best practices from other industries that have been innovative and consumer oriented and data oriented, all the things that the industry might need. Then what about the talent management itself? Less about the recruiting, but what are you seeing your clients doing to kind of help maintain their leaders, right? They don't want to lose them either, right? Once they get them, they want to keep them. So what kind of things are they doing to kind of keep good people and help them build that skill set that you're talking about?
Sure. A simple mindset I think that people have around recruiting is to continue to nurture potential candidates and stay in front of them. Well, the same thing applies to those that are already working for you. You should be nurturing those relationships in the very same capacity. But I think as much as anything, employees, top talent in particular, they have choices. They can go any number of places in outside industries. So they want authenticity. They want to believe in a larger mission. Healthcare does afford that. But sometimes people get lost in the weeds and forget that the mission drives the entire operation. So continuing to keep that first and front of mind, I think is going to be a big deal for any kind of retention effort. But I go back to authenticity. There's so much corporate speak, right? We get lost in the corporate website and flyers and pamphlets that look like they can be written by AI because they say largely nothing. But leaders that really care, there's a tapestry that I have down in my other office that says, give a damn. I think it's a pretty simple way to look at employee retention. If you simply give a damn about your employees and do what's best for them, it's very likely to be what's best for your healthcare organization as well.
Yeah, I love that. So, it's interesting though, you talked about the mission and, this idea of aligning your personal purpose with your organizational
Right.
purpose or mission is kind of a hot topic these days. And sometimes it sounds a little, I don't know, contrived. But do you find that, especially in healthcare, that a lot of the people that are drawn to this are drawn to the mission and that the enterprises are able to kind of help people connect with it?
I do. I think as a people, we like stories, we like community, we like to gather around ideals that we all believe in. And that is the draw with education. I think that's the draw with healthcare. Not always does healthcare afford you the highest compensation, for example. So there's got to be a passion around the greater good, the mission, patient care, health literacy, health equity. There's a number of things that people are drawn to. I've always believed you can have two things at the same time that aren't mutually exclusive, and that is you can have great margins, great mission, and still provide great patient care. That can all come together. And I think if people believe in that, they will be drawn more to healthcare than what we have seen.
You mentioned the kind of compensation issue, and I think sometimes people think, oh, doctors make all this money or whatever. And we know that at least the level down nursing and all the care staff, it's a pretty brutal job and not necessarily always the biggest pay. You've talked a little bit about some of the challenges, but how are you managing to recruit people to this this place besides, I guess, the mission? Is there some like team affiliation that's important, or what do you do to overcome some of that?
Sometimes people join a company because they believe in a larger mission, but ultimately they stay with the company or they're sold on a company because of who they get to work for and surround themselves with daily. So there's a lot of axioms about culture and the entire organizational view of culture, but that's so much less relevant than the team that you get to work with. So I'm fortunate I can choose the clients that I work with, Seth. So I work with people that I think are extraordinary leaders. And when I go and do a search for an extraordinary leader, it's much easier to connect the dots. When I introduce someone to a team of high achievers that really want to do good things, it's easier to sell the idea of working at that organization. And of course, you tie in together all the mission-based ideas, but still, that's what matters most, who you work with. You don't leave a company, you leave a manager. Well, the opposite is true. You come because of a leader and a manager as well.
Again, great points, because we talk a lot about culture. We talk a lot about corporate culture. In my space, we talk about culture of health. There's a lot of relationships between, having a manager that you think has your back, so to speak. But this idea of there's little cultures, basically teams. It's so direct about your team. It's just kind of the people I work with is, obviously I can't have a toxic big culture and have just a safe little team, but the team thing seems really important. It makes a lot of sense to me. Are there other areas that you're, kind of trying to address when you're either hiring or working in the search to say, look, we've got to overcome this issue or that issue, or you're just having a hard time finding people?
It's always tough to find top talent, right? They tend to hide under rocks or they're satisfied where they're at. So much of what I do is networking and connecting with smart people and finding out who they know. So the outreach for top talent should never end. The advice that I give my healthcare colleagues is they should be doing the same. Yes, my entire business is predicated on the idea that you probably haven't done enough of that. So you hire me to help you out. But all healthcare leaders should be nurturing a candidate group that they're interested in hiring, perhaps one day down the road. So you should be networking. It should be something that is on the job description for every leader within healthcare to stay on top of their industry and to reach out to people across their network. That's going to make things a lot easier so that when you have the need, it's no longer a knee jerk or you make a bad decision along the way. So those are important things that I try to get across. When I'm talking to HR leaders in particular, the idea of matching your talent strategy to the organizational strategy. And this isn't especially novel, but I think contextually, that's where people tend to miss the boat. HR leaders are great at talent management, but they don't always understand the business. And so they fly off and start dealing with a HR project that may not be in relation to the organization's needs. So aligning that is a big part of it. And that's part of what we do with the executive search is we find people that are aligned to the organizational's goals. And that means they're going to be much more successful.
So what's an example of where there's an organizational goal or strategy that is not necessarily aligned with the HR strategy?
Well, HR can get lost in doing, I don't know, we're going to revamp the career website. We're going to do a new performance management program. these things may be in a vacuum are great ideas, and perhaps they're aligned to business strategy. But if there's a new merger and acquisition set of activity, let's say it's a private equity backed and we just acquired 100 new practices, well, that stuff's going to have to go on the back burner so that you can assimilate these new organizations and get them on board, make sure you don't lose top talent along the way, et cetera. So the business strategy and the CEO's charge dictates how HR needs to play. And that's not to say that HR shouldn't have influence on how that works, but doing nice to have fun HR projects is not the way to success. You have to understand the business needs and align them.
Sure. So this might be a little bit tangential, and you started this, sounds like right after COVID or
Right.
the heels of it. But obviously, the healthcare sector was hit so hard during COVID. It was very brutal. I spent a lot of time with my clients, a lot of mental health issues, a lot of, okay, everybody's ramping up their employee assistance programs. They're trying to do that. But one of the things that happened during that time, too, is for my first time in my career, I had an executive come to me and say, I'm dealing with something I've never had to deal with before, and it's politics at work. And it was this idea that whether we want to black it out or not in our minds, during COVID, not only was COVID hard, but politics and civil unrest was hard. And sometimes you had literally people wearing their beliefs in their clothes or in a hat, and somebody's just trying to go into a break room, have a cup of coffee and breathe for a minute. I'm wondering if you hear this. I know it's a little bit of sidebar to the recruiting, but you're dealing with these clients who are talking about their issues, I'm sure. Did that come up? And do you have a take on like what clients are doing to make things, authentic, but still feel inclusive?
Wow, that's a deep question. Well, I certainly dealt with it as a chief HR executive. I guess my overarching theory or philosophy on it is a little more passive. I don't tell people that they can't talk about things at work. I find that backfires every time that I've tried to do that. Nobody's let it talk politics. I think you just embolden people to complain, and now they can't really be whoever they choose to be, right? So that's a tough place to go. Ideally, nobody brings all that external stuff to the office and everybody's happy, but that's not real. I don't know that I've had to deal with specifically wearing the hats and the shirts and creating all the negativity, but if that's happening and it's creating such a divisive mentality, then it has to be addressed on a performance issue. My thinking is you probably need to avoid telling people that they can't talk about certain subjects. If we're talking about authenticity, then I don't know how you separate a person and their beliefs from what they do at work, because it's so intertwined, and perhaps now more than ever. I think you just try to have to shape it to some degree so that the positive discourse is what's the most prominent, not the negative. I don't have a silver bullet for that, Seth, but
Yeah.
I would advise against telling people they can't talk about something that they believe in.
Yeah, I appreciate that. Yeah, the way we ultimately shaped it within the context of kind of diversity and inclusion, to say that diversity is not just about physical characteristic diversity,
Sure.
but it's diversity of thought. And that why we think diversity is good is because people bring different thoughts, different cultures, different ways. But to be forced upon is one thing, but to understand diversity. So in my mind, a lot of the diversity training, the inclusion, the belonging training might help people with their communication skills a little bit.
Right. I don't remember the axiom, but we're so tolerant that we become intolerant, right? It kind of folds over on itself, or we're so tolerant of everything that we're intolerant of this person who may not believe exactly the orthodoxy that we believe. And so that's the challenge. That's HR in a nutshell, and dealing with employee relations is how to manage different personalities and belief systems so that it's inclusive of a lot of different thoughts and beliefs. And I think that suit can be productive.
Yeah. And I know many would argue also that it's a little bit, maybe some people don't think culture comes from top down. There's sure a big role model. We used to say, what's the shadow you cast? We all cast shadows, but
Right.
leaders cast a shadow. So how do they handle that diversity? So I think I also told you that and the podcast is sponsored by EdLogics. It's about health literacy. So this idea of health literacy, and what I talk about is health literacy 2.0, the idea that 1.0 was really kind of boring brochures and maybe writing low literacy, but not something that people are too excited about or really think that this could be very helpful in the big picture. Whereas 2.0 is taking behavioral science and gamification to help people learn, adding data so that it's highly personalized, and then using multimedia platforms like videos and infographics, as well as deep content. And those three things bring us to a very dynamic way of presenting information and allowing people to basically get empowered and enable them to have the knowledge and skills and confidence to navigate the system. I'm curious, both because you're in the healthcare space and also as an HR person who's had some responsibility for well-being and benefits, SPD summary plan, descriptions, all that stuff. Health literacy on the radar at all? Am I out there on the edge? Where do you see it fit?
No, I think they're very well aligned. In this country, we've coupled health insurance with employment, right? So the degree to which employers take some ownership of health literacy as it relates to their benefit plans, it's going to benefit the organization when people know how to navigate the system the most efficient way. It's going to be cost effective for them. But of course, it also benefits the employee and the entirety of that person and their family to understand how to navigate it. So I think some of the things you mentioned, meeting the person where they're at, whether it's on their phone with multimedia, notifications, gamification, all these different types of things, so that they have more informed decision making. That's absolutely things that are happening in the employee benefits space as well as external from that. So I think they're married up quite well. In fact, I don't know how you could possibly decouple that. So yeah, you're right there with it.
Yeah, it's interesting because, again, how complicated the benefits ecosystem is. There's so many things in it already. And I do believe that employers want the best for their people and create all these resources and benefits. And yet people don't know how to access them, don't know what's available to them. And it's a very crowded space. And now trying to figure out where health literacy fits in that ecosystem has been an ongoing challenge. Some would argue maybe it's the front door to the whole thing, but others might say make it available when someone's searching for something. I know you don't necessarily think this is it.
I don't have all the answers for sure, but people do respond to incentives. So give people the incentives to get more informed about their healthcare. That's a lot of what you've seen in the benefit space, right? You get discounts or credits and wellness credits. A lot of that's been tried with multi degrees of success and failure, but finding how we can incentivize people to make choices that are beneficial to their long-term well-being and their families will help organizations and their costs as well. That's a win-win.
Yeah, appreciate that. What's the biggest gap? Like, you're searching for a leader, you find maybe some people, but they don't have X. What is it that maybe you're looking for that's really hard to find in a leader?
Oh, wow. So much of that's going to be dependent upon the role. And I'll give you a better answer than that, but I do think it's ultimately dependent. But I mentioned systems thinking. That's a big part of it. I think in healthcare, no place is that more important.
What's system thinking?
Well, so system thinking would be the ability to create, perhaps it's automation, but sustainable practices and systems that allow you to be at your best every day. Effectively, that's it. Some people like to, fly by the seat of their pants, or they think they're instinctual leaders, these kinds of things. And perhaps there's value there, but you want to improve the employee experience. You want to improve the patient experience. You create repeatable systems. Now you have a baseline and a foundation from which you can measure. It allows you to have data on and on. So that's very important in healthcare. I know it's important on the clinical side, but on the management side, it's becoming more and more important. So that's a big piece of it. Another thing that I look for quite frequently is persistence and resilience. Those two things kind of go hand in hand. But people that can, get knocked down and get back up again effectively. Healthcare is a tough place to be. Reimbursements are rarely at the pace of inflation and other changes in the marketplace. So you're always scrounging. And so it takes somebody who's innovative, but understands that not every day is going to be a victory. And you got to get yourself back up again and go in. Those kinds of attributes are critically important for healthcare leaders. And that's true whether it's in the private equity space or the community-based space.
Got it. Yeah. And I think you've said it a couple of times, finding people that are kind of systems oriented, create best practice and protocols, something that you look for.
Absolutely.
So that brings me kind of this question of, all right, so we did cover some ground. Did we miss anything that you think people who are looking for talent really should keep in mind, or that also, as we talked about when we prepped a little bit, keeping talent is also a good thing. So, you know, little gems on either looking for and or keeping talent that you want to reinforce as we close out.
Keeping your talent's the best approach, keeping them happy, keeping them engaged in the work. But that does start with leaders. So if you take good care of your leaders, you give them the resources to be successful, they will therefore take care of the people, and you'll have less of a need for people like me to come in and do your leadership search to find new people. The big part of it is to keep your networking, both internal to the organization and external, going. That nurturing component is a big deal. The final thought that I would have, if you have to go out and find new leaders, and of course you will always be in that situation to some degree, create a great candidate experience. Put your best foot forward. Nothing is going to illustrate your competency or lack thereof than the way that you interview, bring people in on site, and go through your interview process. If it feels wonky, it probably represents a wonky organization and not something that a new employee is going to want to be a part of. So pay attention to that. It's not just a buzzword, it's a real thing, and top talent has choices.
Those are really good closing comments because, you know, when you get recruited and you get flown out or shown around and you feel like you're getting interviews with and time with a good amount of people and you have that versus, yeah, hardly met anybody and they didn't really ask me any questions. You're kind
Yeah.
of scratching your head,
Uh-huh.
right? Yeah, no, that makes a lot of sense. The networking thing's interesting. I was talking to some younger people this weekend and they're kind of worried about, you know, talent environment out there. And I kind of reassured them that there's a lot of hiring going on out there to not be shy about while you have a job doing informational interviewing and
Right.
networking. It sounds like you would agree with that at almost any level.
Absolutely. It's true for organizations, it's true for individuals. Not to be a cynic, Seth, but loyalty is a rare thing. So if you're counting on your employer to be loyal to you indefinitely, you're probably a bit naive. So you should always be out there exploring options. Organizations need to be in the same boat. The best time to fix the roof is when the sun is shining. Isn't that the quote? That's applicable here.
Yeah, excellent. Well, Alden, thank you so much. I learned a lot. I really appreciate your time. Thank you again. Really appreciate it.
Absolutely, Seth. Been a pleasure.